My name is Lisa Ford. I'm with Alzheimer's Coachella Valley, fondly known as ACV in our community. I am the Business Development Director here, working alongside of our wonderful board. We've been here in the Coachella Valley for nearly 6 years now. Not to be mistaken with Alzheimer's Association. Alzheimer's Coachella Valley is your local agency that provides lots of support services and programs throughout our community. So this afternoon, I'm honored to have Dr. Sebti in studio with us to talk a little bit about his career here in the Coachella Valley. He's been one of our leading neurologists here for many, many years. I'm not going to steal his thunder. I want him to introduce himself. But we've been not only colleagues but friends for many years. And again, Dr. Sebti, thank you for being here this afternoon and sharing your experiences here in the Desert Cities and a little bit about your practice.
Thank you. It's so nice to be here. This is a great honor for me. I finished my residency and fellowship at UC Irvine, University of California, Irvine, and came to the desert in 1999, and initially in private practice until 2013. And at that time, I started working with Desert Oasis, and I've been working at Desert Oasis Health Group since then. And yes, I love it here. My practice has always been in Palm Springs and Yucca Valley, and it's still the same.
And to be in private practice for all those years and rolling into Desert Healthcare Oasis or Desert Oasis Healthcare, I'm sure that was quite a transition, but one that I know that the organization embraced. And so I think you see a lot of dementia. Your specialty is neurology and your passion in this space. Can you talk a little bit about what you see in your practice and the type of patients?
Of course, thank you. Yes, it has been great because now I can just concentrate on being a neurologist. And you are absolutely right. Majority of my patients are quite elderly. I say a 60-year-old, 65-year-old is my pediatric patient. So I have a lot of elderly patients that we attend to, and unfortunately, dementia is a big part of what we see.
Very good. A lot of research in this space currently. I know we've all seen the recent FDA-approved drugs out on market. Mm-hmm. Can you talk a little bit about what you're seeing maybe in the Desert Cities, maybe nationally, what is to be expected as far as opportunities with any potential treatments or,
Yes. Unfortunately, since I started my career in 1999, that we had medications like donepezil and acetylcholinesterase inhibitors, and then memantine come out. We have really not had anything until this past few years, which you're correct. It is very exciting time because that big span of time, there was really no medications that came out. However, there has been significant medical advances. We now have biomarkers that we can actually use to diagnose people with Alzheimer's disease even before they have dementia, or what we call MCI, or mild cognitive impairment, that it's very early on Alzheimer's, let's say. And that's actually what these medications were tried on. So yes, I am very excited about what's going on now.
Very good. Well, we hear that term all the time, biomarkers. Mm-hmm. It's a friendly, common word among us professionals here in this space. But oftentimes we're asked the question, what is a biomarker? What does that mean? Can you speak to us a little bit about the biomarkers you've been watching?
Yes, excellent question. So a biomarker basically is a diagnostic test that can help you to diagnose a patient, and hopefully also a marker of the disease or disease progression. Unfortunately, in neurology, a lot of times we don't have anything. We don't have a test that actually tells us what the disease is or it's progressing. For example, we don't have a test for migraine headaches, but we diagnose patients with migraine headaches. And the true has been true for Alzheimer's disease for a long time. We have not had any, but in the 21st century, especially from 2010 and on, now these research groups at university systems, they're able to get special PET scans that show, say, the amyloid plaques or the tau tangles, and also CSF studies that can show us a certain type of amyloid up or down, and also the blood. We now have even blood studies. And within the next decade or two, some of these are going to be available. Right now, they're not available for general population, but available at research places. But I am sure within the next 2 decades, we are going to have some of these available. This is a disease that unfortunately has been underdiagnosed. And we know, this is well published, that in 2 years, 2025, just the state of California is going to have 850,000 patients with Alzheimer's.
My goodness.
We're not talking about the big umbrella, dementia, but just Alzheimer's, which of course it has the biggest part of the pie as far as the dementia. But you can do your calculations. We don't have enough neurologists. We don't have enough physicians in the state to take care of this. We need help.
Well, and that leads us into our next conversation, and that is the services provided over at ACV, Alzheimer's Coachella Valley. I know we're fairly new to your practice, and we're so appreciative of your cheerleading that goes on behind the scenes for the services that the group over at Alzheimer's Coachella Valley provide. You mentioned the umbrella, dementia. It took me a while to understand that Alzheimer's is a part of that family. Lewy body is part of that family. There's many different forms of dementia, all of which we see the cognitive impairment at ACV. We recognized early on that the services, while geared towards the patient and to some extent the caregiver because of some of the programs we offer, sustained us for many, many years. We quickly realized there was a gap in the advancement in the services we were providing, meaning we knew that we had the team in place that could sustain and support our physicians in our community. And that's when we reached out to you over at Oasis Healthcare and said, hey, we got a thing, and I think you might be interested in this thing. And we shared with you sort of this vision for a screening center, a free public screening center here in the Desert Cities that we were very proud to launch in the fall of 2022. Brought it to your attention, and you quickly realized the value in your clinical practice. So for today's discussion, I just really want to dive into what that looks like for you in your clinical practice. Maybe initially we start with the introductions and how we introduced the screening center, maybe the aha moment and how you felt we could be of service not only to your patients but to your clinic as well. If you could speak to that a little bit, we'd appreciate that.
Of course, yeah. I remember that day quite well. And when your staff came, and especially one of the people who does this is a nurse who used to work with the OHC. And when they presented what they are doing and what their plan was, it was just something from the sky that just came to my lap, and it was everything that I've always wanted. So what you guys do, a patient, a family, a husband and wife, a child and parent, they can come to you when they feel there are some cognitive changes. And your wonderful staff that you have, they actually do a great job. They are people who know how to do this. They have had experience. They get a great history, which is very, very important, especially in neurology. And then they do the common tests that are needed. And then they provide us with all those. And so when I send a patient to you, and because actually I haven't seen them yet, and all I know is that they want to see me, say, in a few weeks, in a few months, because there are some concerns about cognitive function. I ask him to make an appointment and be seen, and then I get this fantastic report that has done all the legwork. I mean, I feel a little ashamed to say that they do all the work, and I can take that, and it makes it so easy for me to diagnose patient and then talk to them. And then they're already connected to this resource, and it's not just like diagnose them and then you're on your own. That unfortunately a lot of times happens in medicine. You take them and carry and support them.
Thank you for that. Yes, and thank you for recognizing the invaluable team members that dropped into our lab, as to quote your. They did. They were retired professionals here in the desert cities looking for an opportunity to be involved in our community and give back. These two women that now are very instrumental in providing that data to you and sitting with the families. One is a clinical social worker who's been in this world for many, many years. She was on the East Coast, Duke University, and set up some Alzheimer clinics on the East Coast.
Wonderful.
Yeah, she's just, Nan is, she's fabulous. And then, of course, we have Kathleen, who's our nurse practitioner. And she, too, has been in the healthcare system for many, many years. Geriatrics was where her passion was. She was particularly interested in this dementia space. And I know that for both of them, the reception they received from you sort of, nailed it for us. We knew that we were in the right place. So, as you mentioned, these patients, thank you, are referred to our clinic initially before seen by you in your clinic. Our team does all the mini mental exams and all the other cognitive exams that we provide, package that all up, send it over to you. You see them a couple weeks afterwards, or whatever that time frame looks like, convenient for the two of you in your practice. Can you talk about how that might have impacted just the staff flow, and how is your staff receiving now the opportunity to not be inundated with so many duties? That's not really fair to say,
no,
but okay, maybe you could speak to how your staff has been receptive.
Well, it has been fantastic because, as I said, the most important thing, especially in this realm of dementia, cognitive difficulties, is getting a good history and doing the appropriate testing. I'm not talking about MRI or blood testing, but there are testing that are done to evaluate this. I'll give you some examples. I saw a patient. This may have been a few months ago. Then I asked them and I felt I had an idea, but I wanted to get input from the ACV. And then I got that, and I actually was exactly what I thought, but what they did and the history they provided that had some of the details that I had not asked helped me exactly to tell this patient and his wife what we thought was going on, which thankfully was not anything bad. It was not dementia, but that was very helpful, and I had more ground to basically explain to them why and how we came to this conclusion. My staff loves it. They were making sure that I understand I need to take more brochures.
We've got some for you today.
Yes, and they were wanted a special form that makes it easy for them to fill out and send to you. So yes, they're just looking for more ways to really get us bonded to your fantastic organization, and this becomes a routine. And I could be selfish and just keep this to myself, but I am honestly trying to spread the word. I spoke to one of our primary care doctors yesterday. Wonderful. We spent some time together, and he did not know about it, and he was just so happy.
That's wonderful. Wonderful. Well, we're delighted that it has had profound impact in the clinical practice, that we're adding value to the services you're providing your patients here in the desert cities. As an organization, we're always looking for ways to get better. Is there anything that you can think of, perhaps in your practice, that you went, I kind of wish that might be available for, these patients are asking us for this or that. As you know, we provide music therapy, we do a lot of games, we do respite care for the caregiver, we have some scholarship programs. We are out in the community with some of our business partners doing training. Alongside of some of our hospital systems, we're working with their nursing staff, their physician staff. We're always looking for opportunities to grow and, to grow our partnership with you. So is there anything in your current clinical practice or maybe something down the road that's coming that we should maybe watch for and perhaps consider implementing to help support not only the patient, the clinician, our community at whole, but, the whole process of dementia and how we care for these folks going forward?
Right now, I'm just so happy and overwhelmed with things that you do provide. I actually told those ladies that first time we met that you understand that you're going to have to work 7 days a week because the need is there. As I said, there are going to be 850,000 patients just in California. And what I would like to see if steroids or something we can inject to you and see you grow. Okay. So that would be my dream. Okay. I think you already do a lot, but I would like to see you have offices throughout the whole Coachella Valley, wonderful. East, west.
Well, again, there's so many things we'd like to spend more time with you, and I hope you'll come back. But after your patients have been to the clinic and our team there has provided the data that is necessary for them to make the next step and see you in clinic, I think from our perspective, we think things have gone well, but we're always looking for that real good critical feedback and directly from the patient and maybe perhaps even the caregiver. We'd like to understand what their experience was at Alzheimer's Coachella Valley Screening Center when they first come in, and then perhaps what they're reporting back to you.
I'm so glad you asked that question because a lot of times I'm a consultant, so I get a referral, say from a primary care physician or someone else, and then I order things. It can be blood studies, it can be an MRI, and a lot of times patients are unhappy because they feel like I haven't even seen the doctor. Why do I have to do testing? Out of all the patients that I've asked them to come to ACV first before I see them, no one has ever complained, which is the first among all the things I ask patients to do before they see me. In fact, they were very happy, and when I tell them how the report is helping me, they are very glad, and they are already connected to a resource which is invaluable. So yes, it's become part of my practice, and I'm passing the secret on to my colleagues, and I think it's very invaluable for other physicians, for all of us to use this resource.
That's wonderful. I know our team really will appreciate that type of feedback because it's really important to us. And you mentioned there that they feel connected to a resource that is not just a one and done. They know after leaving Alzheimer's Coachella Valley, they're provided a brochure of information should they need us in the future. And between your office, you, and the caregiver, I think we've got it covered, and they know that they're always welcome back in our offices. So, on another subject, and that is last year's vision was the launch of our screening center. We successfully did that thanks to you and all your colleagues. We believe we're having impact. This year's focus is really about impacting a community that doesn't necessarily like to talk about this disease, its diagnosis, and what that means for the family. And I'm specifically talking about the Hispanic population. We've been working with some of our pharma reps that have come out who are running some of these research protocols that are looking for a subset of patients. One in particular is the Hispanic population. They're also looking for African American. We believe that through our relationships with some of our community neurologists, we can deliver some of those patients to them to enter into some of these clinical research. But that also requires that we are able to reach into those communities. So for this year's focus at ACV, we are driven to get out into that community, to start sharing with them the resources that we have, the information that we have, helping them find the clinicians with passion in this space. So thank you for that. We definitely want to do that. And we've had the discussions with both Nan and Kathleen about duplicating themselves somehow for that 7-day week,
Yes.
right?
Yes.
Yeah, so we're really excited about the vision that we have and the future, as you've just described. We really are, I think, aligned in that regard. So thank you for your candid conversation today around a very difficult.
I completely agree with you. I think education is on top of our priority at this time. You're absolutely right. Unfortunately, this disease is more common among Hispanics and African Americans. And it is so important that we educate everybody. The education is for providers, for doctors, to everybody in between. Politicians need to be instructed about this disease and what needs to be planned. Unfortunately, the problem has been that sometimes we just say dementia and it is thought that it's a part of getting old. Dementia is not part of getting old. Dementia is a disease. Actually, it's a symptom that's caused by diseases. Number one, Alzheimer's disease by far, but it needs to be treated. It needs to be attended to. So we have to get rid of this myth that somehow when people get old, this is what happens and progresses, and that's not true. So yes, education on top of the list, and I'm so glad you guys are doing it.
Thank you. Oh my gosh, this has been a fun afternoon with you. Thank you, thank you, thank you. And your professional work here in the Desert Cities is not just in the neurology space. I know you cross over and you have a lot of passions that you are involved in here in the Desert Cities. We wish you and your clinic and your family continued success. And thank you for everything you've done for Alzheimer's Coachella Valley.
Thank you.